Hi, once again, welcome back to Obstetrics and Gynecology videos. Today, we are going to see about the essential newborn care, or we are going to discuss about the immediate newborn care. In that, we will be discussing about the bonding, care of umbilical cord, immediate assessment of the newborn, continuous assessment of the newborn. All these things we are going to discuss in this video. Immediate care of newborn at birth includes maintenance of temperature, establishment of an open airway, initiation of breathing, and maintenance of circulation. So these are the main things we are supposed to consider when we are thinking about the immediate care of the newborn. So basic care provided at birth include delivery of the baby on a warm and clean towel. That's the first thing. And establish and maintain a patent airway, ensure the warmth, assessment and documentation of baby's condition, care of the eyes, clamping and cutting of the umbilical cord, care of the skin, administration of vitamin K, identification of the baby, transfer of baby according to the level of care required, and of course bonding is also there. So these are the main things we are supposed to do in the immediate care of the newborn. Delivery of the baby on warm and clean towel. See, when you are expecting for the delivery time, you are supposed to be ready to receive the baby, and an assistant nurse or a circulatory nurse should be there. One more person should be there for receiving the baby, and that person should keep a tray, and that tray should be covered with warm, clean clothes, and the head end of the tray can be slightly downward. You can arrange in that way so that the secretions will come out of the baby's mouth. And this tray you can keep in between the legs of the mother, and it should be lower than the level of the uterus. And next one, immediately after receiving the baby, you have to maintain and establish a patent airway. The mouth and nose of the baby, we are supposed to suck, and you have to clear the airway from the mucous membrane. Sometimes mucous secretions will be there, sometimes amniotic fluid will be there. The baby might have aspirated the amniotic fluid. So you have to suck and remove this mucous membrane, mucous secretions and the amniotic fluid. And in case if the baby is not crying, you have to give gentle tactile stimulation. You can tap at the sole of the feet, or you can tap at the back of the baby. So those things will stimulate the baby to cry, and the baby will start to take the respiration. And in case even after that also, if the child is not crying, and if the child is not maintaining the or initiating the respiration, even after the initial stimulation also, you have to start the CPR. Next, ensuring the warmth. Already we have seen there is a chance of hypothermia for all the babies. So in order to prevent the heat loss from the baby's body, we are supposed to do the following things. That is, the labor room should be warm. The temperature of the labor room can be between 25 to 28 degrees Celsius. And immediately after receiving the baby will be wet because amniotic fluid is there. Sometimes baby might have passed the meconium, and lanugo is there, vernix is there. So the baby will be having an oily wet appearance. So immediately you have to dry the baby, and soon after drying you have to cover the baby with a warm towel. And in case if you are feeling as like baby needs to have additional temperature, baby is not having proper weight, or if the baby is a premature baby, in that cases you can keep the baby under the radiant warmer, or you can give the kangaroo mother care. Next, assessment and documentation of the infant condition. So immediate assessment you have to do, and the head to foot assessment also we have to do. In the immediate assessment, mainly we are performing the Apgar score. We are checking the Apgar scoring. So in that already we have seen the Apgar scoring in the newborn assessment. So, and once again I will just give an overview. Here the parameters we are checking include heart rate, respiration, muscle tone, reflex response, and skin color. And the scores are given as 0, 1, 2. If the heart rate is absent, score is 0. If the heart rate is less than 100, it is 1. If it is more than 100, the score is 2. And respiration, if it is absent, score is 0. If it is irregular or slow, the score is 1. And if it is good, and if the baby is crying, the respiration is 2. If it is a strong cry, the score is 2. And next is muscle tone. If the baby is flaccid, the score is 0. And if some flexion of extremities is there, means the score is 1. And if the extremities are well flexed, score is 2. And next is reflex response. If it is not there, the score is 0, and if grimace is there, the score is 1, and if the baby is crying or sneezing, in that case the score can be 2. Next is skin color. If the baby is blue or pale, the score is 0, and if the baby's body is pink and the extremities are blue, the score is 1, and if the baby is completely pink, the score is 2. So this we are supposed to check in the immediate assessment. Next, we have to check the weight of the baby. We know that birth weight is having high significance. All those things we have discussed in the low birth weight baby. You have to check the weight of the baby, and you have to see the umbilical cord, and you have to see make sure that 2 arteries and 1 vein is there in the umbilical cord, and you have to make sure the orifices, that is mouth, we have to check first. So you have to see whether any cleft palate or cleft lip is there or not. Then you should see the ear and nose for the abnormalities, and anus also you are supposed to check whether any imperforated anus is there, whether any malformation is there or not, that you should check. Then you can see the urethra. In the case of you can see whether hypospadiasis or epispadiasis is there or not, and you should see the back for any visible lesions. That is, you have to check for the meningocele, meningomyros, that is spina bifida, occult spina, all those things you have to check at the back. Next is the head to foot examination of the baby. First, you should see the skin of the baby. You should see the skin color. That is, you should see whether pallor is there, jaundice is there, whether cyanosis, that is bluish discoloration, is there or not, or whether acrocyanosis is there. So those things. I'm not giving much explanation for these terminologies because all these things already we have seen in the newborn assessment video. In case if you want to have more explanations about this pallor, jaundice, all those things, any of the terms related to this, you can see the video about the newborn assessment, and check the skin for the turgor and for the dehydration. Next, over the head, you have to see for the sutures, whether it is widely spaced sutures, and you have to see the condition of the fontanelle, whether the fontanelles are depressed or bulged. You should see those things over the head. And the skull, you are supposed to observe for the cephalhematoma and for the caput succedaneum. And face, you should see for the symmetry and for the malformations. And in the eyes, you should see for the position, symmetry, and the distance between the inner canthus should be 2 centimeter. You should make sure that it is 2 centimeter. Otherwise, you can suspect the congenital malformations, congenital or chromosomal defects of the baby. You can suspect. Next, you should see the ears. Check whether any malformation is there, whether lozate ears are there or not, and you should elicit the startle reflex, and you should make sure that the baby is able to hear the loud noise, so it indicates audibility. Next, you should see the nose. You should see the nostril for the nasal bridge for the shape, and you should see the deviation of the nasal septum, and you can see whether nasal flaring it is there or not. If it is there, means it indicates a respiratory distress. Next, the mouth. Observe for the cleft lip, palate, and oral mucosa, and for the white plates you have to, and of course you have to see for the natal tooth, Epstein pulse, all those things. And next is the neck and chest. You have to see for the respiratory movements. You have to see the nipples, nipple line you have to see, and you have to see the shape of the chest. Next, over the abdomen, you have to palpate for the masses, and you have to see for distension, and over the umbilicus, you have to see for the umbilical hernia, and you should auscultate the bowel sounds also. And when you are coming to the feet and hands, you have to see the transverse palmar creases. If it is there, it suggests that Down syndrome, and observe the number of digits and see whether any webbing of the digit is there or not. And genitalia of the baby also you have to see. In the time of full-time neonates, the labia majora and clitoris will be visible when separating the labia. Otherwise, the labia majora and clitoris will be protruding, and it will be visible even without separating the labia majora. And in male neonates, the scrotum will be large, and it will be darkly pigmented, and rugae also will be there, and testis will be descended into the scrotum. You have to see for all these things. And next is the care of the eyes. Immediately after the birth of the baby, after cutting the cord, you have to clean the eyes of the baby by using the sterile cotton ball and by using the sterile water, and clean from the inner canthus to the outer canthus. And after that, if it is needed, you can give medicated eye drops in order to prevent the infection of the eye. Next is the care of the umbilical cord. Immediately after the birth, you have to see the ideal time for clamping the cord, and after for clamping the cord you can use two coccus forceps, and it should be placed 5 centimeter away from the umbilicus, and you have to make a cut in between these two coccus, and the length of the cord leaving behind the navel, it should be observed for the oozing and for the abnormal secretions. You have to see, and you have to make sure that it is the balance of the cord is clamped well, otherwise there is a chance for oozing and leakage of blood through the umbilical cord. Next, for the care of the skin, we know that the skin of the newborn is delicate, so it should be gently wiped off blood, mucous membrane and secretions. And nowadays we are not practicing the baby bath because there is a chance for getting hypothermia for the baby. Next, administration of vitamin K. A single dose of 0.5 to 1 milligram of vitamin K is given to all newborns within 6 hours after birth. Another important thing is identification of the baby. Before transferring the baby from the labor room, an identification band should be placed over the wrist or over the leg, and it should contain the name of the mother, registration number, date and time of the birth, and the gender of the baby. Next, transferring the newborn. If the newborns are healthy and if they don't have any problem, we can transfer them to the mother, and you can encourage the roaming in. So you can allow the baby to be with the mother 24 hours. So this will help for initiating and establishing the bonding, and even it will help for the proper initiation of the breastfeeding also. In case if the baby is having risk factors or if the baby is sick, in that case you can transfer the baby to the neonatal ICU. So thank you for watching this video. See you once again with a new video.